What is macular degeneration treatment? For the early stages of macular degeneration, no treatment is actually required. A healthy lifestyle with a diet rich in vegetables is important for the general overall health of the eye. That's because the center part of the retina, the seeing membrane of the eye, called the macula, needs a high concentration of chemicals called luteins, and these can only be obtained from plant diets. The body can't synthesize its own luteins. Most of us, even though we are well nourished in calories, aren't necessarily nourished with the right level of nutrients we need, especially micronutrients like luteins. Luteins are present in plants, especially green leafy vegetables or colored vegetables. There are also a host of lutein supplements that are available. They vary in the dose, and I can advise you of what would suit you the most when I meet you at your consultation. Intermediate macular degeneration can be treated with certain nutrient supplements. The Age-Related Eye Disease Study 2 identified a certain vitamin formula that can help reduce the risk by up to 20%. There are many vitamin supplements on the shelves of supermarkets and chemists that claim to have absolute value in preventing blindness. And again, I have seen patients buy unnecessary supplements where there is no evidence base. This is something that we can discuss in great detail at your consultation if necessary. As the disease progresses to the advanced stages, the treatable forms of macular degeneration in available practice include treatment for neovascular or wet macular degeneration with injections into the eye. Horrific as it sounds, it is extremely safe and painless, and it is very effective at preventing the previously certain blindness that occurred from wet macular degeneration. When I started my ophthalmology training, the most I could tell patients was that they would lose their central vision but never be completely blind. Now, thanks to the revolutionary new drug technology we have, I have the ability to tell patients we can stabilize vision in 90% of patients and increase vision in anything from 30 to 60% of patients. The NHS does treat macular degeneration very well. Unfortunately, patients are restricted in terms of the vision within which the NICE criteria allows treatment on the NHS. If the vision is better than 612, patients cannot access treatment on the NHS. If the vision is worse than 696, patients cannot access treatment on the NHS. That's partly to protect them. When the vision is very bad, it's usually an indication that the disease is very advanced. One of my patients has had a remarkable increase in vision following treatment despite being recorded as worse than 696, and I'm overjoyed about this as this was her only seeing eye, and every gain made a significant improvement to her. My main concern with the NHS guidelines is that patients with the best vision, that is vision better than 612, cannot access treatment, even though the drug is proven to be effective at stabilizing them at that significantly higher level of vision. And that's what we all want to do, give patients the best vision that we can. These are two of the reasons why patients seek treatment in the private sector. So patients, even with types of macular degeneration which at the moment do not have standard care treatments, such as the atrophic or geographic atrophy type of macular degeneration, should be reassured that there is a host of research available, and there is likely to be ways of slowing down the progression in the not too near future. There are trials involving drugs such as lampalizumab, and the indications of these will become clearer with time.